Good morning, everyone, and a very warm welcome to this webinar, which forms part of the Early Career Research Forum webinar series. So these are a relatively small group events set up to allow colleagues to share their research and expertise on research topics of interest to your networks and to provide a space for discussion in a supportive environment. So the webinars are recorded and are available on the Palliative Hub Professional. They are shared widely and have often large numbers of views over time. So the question and answer session will not be recorded. And if you would like to enable captions, please do so at the bottom of your screen. So first, some housekeeping. So please keep yourselves on mute during presentations. Rename yourselves so that everyone can see your name. Turn your camera off for the presentation, please. And if you need assistance, we will help you. There will be a time for questions at the end, but please feel free to put a question into the chat at any point. You can also raise your hand to speak during the discussion. So I would like to now introduce our speaker for the day, Dr. Natasha Bradley. So Natasha Bradley is the Marie Curie Senior Research Fellow at University College London, based at the Marie Curie Palliative Care Research Department. She was previously based at Queen's University Belfast as Research Fellow for the IPCO, the Integrated Palliative Care and Oncology Project, and prior to that was a Research Fellow in Realist Evaluation at the Centre for Health and Clinical Research, University of the West of England. Her research has included topics of social support and hospice day services, digital exclusion, and implementation challenges in the hospice sector. She is particularly interested in developing research methods suitable for addressing the complexity often inherent in palliative care. So over to you now, Natasha.
Thank you, Stephanie, and thank you to the Institute for inviting me to speak today. I'm going to give an introduction to Realist research methods. I've got about 40 minutes to present, so hopefully we'll have a good amount of time for questions at the end. My email address is here. This is an introductory session, so if you do wish to follow up with me, ask any further questions, do feel free to get in touch. So the intended outcomes from today are for you to be able to recognise the type of research question that could be suitable for realist methods, to understand the difference between realist evaluation and realist synthesis, which is the main two types of methods that I'll be talking about, to approach some of the key concepts in realist methodology. So I'm going to be talking about program theory and context mechanism outcome configurations, and hopefully by the end of today, you'll understand what I'm going on about with those. And finally, to consider some of the challenges that might be involved in applying realist evaluation and realist synthesis. So what is realist evaluation? I'll start here. So Pawson and Tilley introduced realist evaluation to the world, and the reason they did this as public health evaluators at the end of the 20th century is they were growing frustrated with the limitations of the research methods that they had available to them at the time. So public health was at the time attempting to apply randomized controlled trials to public health interventions. And what you have in this diagram is someone talking about their experience of implementing the same program or two programs in two locations. And from their perspective, they're the same program because the intervention is the same, but they're in two different places. So site one is a rural mountainous village and site two is an urban metropolis. And the person presenting hasn't got the foggiest about why it is that the intervention worked differently in those two different places. And that's because the methods are context blind. It's a bit of a jargon word, but saying that some methods don't wish to take into account context in their evaluation of the outcomes of a particular intervention. And for Ray Pawson and Nick Tilley, this was a limitation because it meant they couldn't understand how and why something worked, which meant they didn't have the knowledge about how to adapt it to different settings. So they wanted to establish this as a rigorous evaluation of real world interventions, policies, or programs. This word programs comes up a lot. It's an umbrella word, so any kind of intervention or policy or set of interventions that are intended to achieve a particular goal, you might label as a program. And Pawson and Tilley drew on the philosophies of scientific realism and critical realism to develop realistic evaluation, or what it's now known as realist evaluation. And the aim is to explain how and why things happen, not just describe or measure what happens, to understand how outcomes are caused within a particular context. So realist evaluation came first, and it was shortly followed by realist review or realist synthesis, which was using the same logic but applying it to a literature review. So a realist review is a realist version of a review, an adaptation of the systematic review process that some of you might be more familiar with. And it's a secondary research. So you're not usually collecting data, you're synthesizing published evidence, and you can use a range of different sources of evidence, not just academic literature within a sort of narrow confines, but you need to make that choice. But it's very suitable if you do have a range of different types of evidence and you're interested in how and why something's worked, and digging deeper into that. Realist evaluation is primary research, so you're collecting data within a realist evaluation within a particular program or group of programs, so that you can explain how this program works and for whom. And just to mention critical realist, because you'll see publications using critical realism as a method. Critical realism is both a philosophy and a method, so that can be a little bit confusing. And it's a form of qualitative inquiry, so not quite as structured a method by Pawson and Tilley, not a sort of separate stream of work, but it is underpinned by a similar philosophy. So critical realist qualitative research usually seeks to explain and critique social conditions, understanding how choices recreate or change the structures that have caused those choices. So you don't need to worry too much about that for this presentation. I'm focusing on realist reviews and realist evaluations. So if we take a step back, we're going to start thinking about causation. I'm going to use a couple of examples to help you here. So what does it mean that X causes Y? How can you say that Y has been caused by X? So in this example, imagine that you're presented with this table and you're told these teachers were taught the same syllabus, but in different ways to different pupils. And you're asked, who's the better teacher? And when you first look at this, you might think, okay, well, the scores are higher in the right-hand column, therefore teacher 2 is the better teacher. And that's a straightforward answer, but there is some relevant information that's missing from the table. So if we have a look at some of the things that might be relevant to understanding who is a better teacher. Teacher 2 led the finals in term 2, and teacher 1 led the mocks in term 1. Class A were resitting from the previous year, so they've already gone through the syllabus once before. And Class C were learning digitally, so they had lower attendance and perhaps lower engagement with the materials than the other classes. And then there's sort of a value statement about about what it is that we mean by better. Is it just exam scores that matter to us in that context, or are there other aspects that are important? So you can see that they've all of these aspects of context that make a difference to answering the question. And it's not so straightforward to just say that teacher 2 caused those exam scores to be higher. And this is because there are so many different things that can influence change, and change is happening constantly. So in this cartoon, we've got someone presenting a nice linear model of causation. A turns into B. That's fine. That's simple. We can understand that. But as soon as you step outside that room, you see it's actually not so simple as that at all, because all of these forces, it can interact, they can generate or prevent change, and labeling one as A and one as B is not so straightforward. And there are aspects of change that matter more with social agents, so with people, than they do if you're studying a chemical in a lab, or how a medicine works in a body, because social agents can make choices. The time matters, which the order of choices, what came first and what came second. Different forces can compete or have rivalry. So And a nice example of this is you might want to eat healthy, but you might also really like ice cream. And those are two things that are in competition. And how things are introduced to your life or to other people's lives makes a difference. And also, emergence is a key thing to think about here as well. How does the change that happens first, does that influence the changes that happen later? So we'll come back to that a little bit, but just to say, it's not so straightforward as A to B. I'm just going to give another example of a rainforest or a forest. So if you think about looking at the canopy of a forest, you can see that the leaves of a tree are very green and luscious, and that's very nice and easy to observe. But actually, to understand why the leaves are so green, you need to go deeper. So you can't understand leaves without knowing about the trunk, about the roots, and about the biochemistry of the soil. And actually, the soil is much harder to observe than the canopy. And what I'm trying to get at here is that reality is multi-layered. Explanation means going deeper, going to things that are a bit harder to see, but that they explain the things that are easier to see. And this relates to this argument about context. So for a realist evaluator, their argument is that nothing works everywhere for everyone. So to understand what works and for whom in what circumstances, you need to have some understanding of the context that you're operating in. And this means having theories about what's happening and probing those theories. So now that you're an expert in plants, imagine that you walk into your office and your colleague says, "Can you help me? My plant is not very happy. I don't know what to do." So the first thing you'd probably do is look around and think, okay, well, the plant's next to a radiator and next to a window. Is the temperature not working for it? Has it got enough space in that pot? Is it getting watered at the right amount? And you might even think about something unexpected. You might think, oh, those are the things I'll try, but maybe there's something else going on that I'll test afterwards. For example, that the radio station is bothering the plant in some unknown way. So as you go through the world, you do have theories in your minds, and it's about sort of allowing that in, being theory led in your inquiry. So contextual thinking and causal explanation, really something that we do all the time as people, and it's about having those theories. A program theory is a hypothesis about how a change happens within a given program or intervention. So you could phrase it as the if, then, because. So the intervention, for example, here, really simple, a speed limit introduced around schools. So the underpinning program theory there could be, if a speed limit is introduced near schools, then fewer children will be killed or injured because drivers are reminded to drive carefully. So program theory sounds like a bit of a jargon, but it's actually just the underlying reason why an intervention is thought to work. But the example that we've given there has got some depth, but not very much. And we talked about rainforest before. Iceberg is a similar idea. So above the water, easy to see. Under the water is what causes what you can see above the water. And actually, the whole iceberg, you need to think about the whole iceberg to understand the bit that's sticking out the top, and also the physics of the water that causes the iceberg. This is a great paper. There are a couple of great papers spotted through my slides that I advise you to follow up. But so if you think about the top of the iceberg is the observable reality, and we call that empirical because it's possible to measure it. Underpinning the thing that you can see easily is the rest of the iceberg. And the water itself is what causes the iceberg to exist, or sort of the physical properties of the water and the temperature and the salt and everything. So ontological depth is about going deeper into explanation. So you're not just thinking about empirical, observable reality, but you're thinking about the real world that causes what's easy to observe. And ontological depth could also be worded as stratified reality, or they link together. So Roy Bhaskar is a really key critical realist philosopher, and he came up with this idea of approaching the world. So the empirical domain, what can be experienced, easily measured or observed. The actual domain is what causes the things that can be observed. So the events and actions, or the absence of events. And the real domain is what causes the actual domain. So the real is what causes those events. So things like power dynamics in society, related to gender, just as an example, those are seen as real in the realist world because they have actual effects that lead to observable impacts. But the slightly different contexts, the events that arise from power dynamics aren't the same as the power dynamics. They're in a different domain of reality. And then the things that are available to measure in relation to that are in another domain again. I hope that makes sense to you. If it doesn't, it will do in the future. It's sort of, you have to repeatedly expose yourself to the idea and it gets a little bit easier. Last example. The leaves changing colour when you look out of the window now. Brilliant time of year for this. You can say, okay, the leaves are changing colour, how beautiful. And when you look on the calendar, you say, oh yes, it's autumn, first day of autumn, just last week. But the fact that it's autumn doesn't cause the leaves to change colour so much as the tilt of the earth in relation to the sun and the way that that influences the chlorophyll within the leaves. So as much as for some purposes, all you need to do is look at the leaves and say, great, they're a different colour now. For other purposes, you might need to go deeper and understand more about the physics involved. And the same logic applies to the social world. I just want to position this way of thinking in relation to other methodologies that you might have come across before. And we'll often see this sort of line, these ideas that two poles that are in competition or at least separate. So on one side, we've got relativist or social constructivist work, often associated with qualitative methods. And the other side, we've got positivist or empiricist work, so often associated with randomized controlled trials. And for positivist work, positivist research, the underpinning ontology, so understanding of how the world works, is that reality is objective and that it exists independently to the observer, so that the researcher is separate to the thing that's being researched, and that actually objectivity is very important, and that group of methods have a number of steps to ensure that objectivity. Relativist work, a lot of qualitative schools, the reality is subjective. So it's not about understanding an objective reality, but recognizing how our world is socially constructed. And the methods will have things that recognize the subjectivity is important. So aspects of reflexivity, revealing the researcher in relation to the work, doing autoethnographies. That's all recognizing that the researcher is a part of the reality that they are researching, and in some cases even constructs that reality. And there is a third position available, and that's what I'm trying to bring to you today. So critical realists, or many realists, argue that there is a mind-independent reality. So reality does exist separate to our experiencing of it, but we may never be able to view all of that reality and not view it objectively because our experience is subjective. So we do interpret reality, but reality is separate to us. It will continue if we stop experiencing it. So I'm just going to run through some key sort of terms in a moment to wrap up this section, but this slide is to say to you, realist means that the world exists, the world is real. independently to our minds or to our research methods, the world exists. And there are these other threads of realism, but unless you really like the philosophy, you don't need to go hugely deep into these. Use what you need, look into it enough. I really like this, but there's still so much that I could read on it. So yeah, there are lots of useful papers that will introduce the philosophical concepts in more depth. But what I'm saying here is that scientific realism and critical realism and even quantum realism have the same underpinning argument that that reality is real. So the main concepts that we've looked at now is that realist evaluation is a form of theory-led evaluation that aims to understand and improve interventions happening in the real world rather than in a controlled laboratory setting, for example. Realist synthesis or realist reviews are about applying those realist principles to synthesize evidence. A program is any intervention, policy, or initiative that's intended to create change by providing resources to a particular context. And a program theory is the underlying hypothesis. So it explains the mechanisms that are expected to operate, how the context affects those mechanisms, and the outcomes that are expected to emerge from that context mechanism interaction. And that's what we're going to spend about 20 minutes or so explaining next. But finally, ontological depth or stratified reality, the idea that empirical objects that are observable are the result of actual events, whether those events were observed or not, and that those events are caused by real structures that are usually unobservable. We are going to do proper questions at the end, but just as we're wrapping up that philosophy section, I'm just going to pause for 10 seconds or so for you to scribble any notes or questions that you have in your head before we move on. If you're brave, you can start typing in the chat box. But so most of the interventions that I've come across in my research career have been described as complex interventions. That's a buzzword that we hear all the time. And that's something that I'm going to unpack a little bit in this section. So you might have come across this argument that we need to open the black box of complex interventions, that it's not enough for research to just tell you what the inputs and the outputs are, but actually understanding what's happening inside is important. So interventions or programs are about applying resources to a situation or a context with the expectation that something will happen leading to desired outcomes. So the people that are involved in providing an intervention or designing it or receiving it, they're social agents, and they make choices and they take actions, or they don't take actions. But that's part of the choices that they make. They make those choices within a particular context, and that context determines what choices are available to them and what the consequences of those choices will be. So that means that the context shapes which choices are available, which mechanisms, is another way of thinking about that, can fire to generate a change. And I've put fire in quotes there because it's not so much an on-off switch. That can be a little bit unhelpful to think of it like that, but mechanisms are sort of reasoning, emotions, things that are usually going on inside someone's head. So it's sort of what activates it or what generates it. So you might start to think about explanations of complex interventions as some kind of combination or configuration of something about the context, something about the mechanism that happens, and that leading to an outcome. And that's where we get this phrase CMOC. It's just context, mechanism, outcome, configuration. What is it that we actually really mean by complexity? And what that's going to be helpful for us to think about what that means for our research designs. So just as a quick definition, a simple problem, it might have multiple steps, but if you follow those steps again in the future, you're quite likely to have the same outcome as you did the first time. So, for example, following a recipe to bake a cake, that could be considered a simple problem. Complicated problem might contain sets of simple problems, and those simple problems might require coordination, and there might be a large number of them, or they might need specialist knowledge. But again, if you were to repeat the same steps within the same order and by the same team, for example, you'd be expecting the same outcome. So, for example, launching a rocket into space. I hope there aren't any rocket scientists on the line that are getting offended by me not calling that complex, but complex problems are likely to contain a mixture of simple and complicated problems, but they also involve some kind of interdependency, interaction, or unique local influences, and that require some capacity to adapt as different conditions emerge. So an example could be raising a child. Even if you followed the exact same steps with one child as you did with another, you wouldn't expect the same outcome. So when we apply that to complex interventions, we're not just thinking that it's happening in multiple places and that there's different people involved and different goals perhaps within the same intervention, but also considering aspects like feedback loops, how one outcome influences another, how change emerges from the change that's been initiated, that there might be unintended consequences or tipping points. So ways in which the different problems within an intervention and the different changes can interact with each other. And what I am attracted to realist evaluation and realist synthesis for is this idea of not trying to run away from complexity or pretend that it's not there, but that actually digging in. And there are some challenges to this. I'm sure you can start to think about what those might be. But asking not just, does this work, but how does it work for whom and in what circumstances allows us to bring in complexity to our answers and develop what we could call complexity tolerant explanations that actually might have more portability or transferability than context blind or simplistic explanations. So if you come back to this recording or you have some time after the webinar, this is just a practical exercise to help you think about complexity, sort of turn those cogs. So the next slide, we have this thing called the victory checklist. And that's part of Pawson and Tilley's approach to starting to think about planning a realist evaluation. So questions to help you approach the complexity within a particular situation. So if you imagine, I was trying to think of an example that would be most suitable for a palliative care audience, but I thought this one would do. A healthy cooking club for carers. So you're someone that wants to help carers by introducing healthy cooking clubs where they'll learn some new recipes, get some free vegetables, meet other carers. If we look at the checklist, there are all of these different aspects of complexity that could be relevant. So I won't go through them all, but even just starting with volitions, what drives people to make a change, what choices are available, and what choices do they make? So why is it that the carer would come to the club? What choices do they have to make in order to get there and to benefit from it in the way that you expect? And what choices are relevant to other people as well, yourself as the person introducing it and the people that are delivering it? How do their volitions shape the situation? We've got a number of questions here that you can make notes around, and you can also apply this checklist to your own intervention or program or place of work and start to just think in this sort of complexity tolerant way. So hopefully you've got an idea of this now, but what is realist evaluation for? It's where we're asking what works or doesn't work for whom, in what circumstances, to what extent, and focusing on causation. So, not observing what happens or even inquiring into the lived experience, but explaining how and why things happen. And we're aiming to understand how context and mechanisms interact to explain outcomes. The evidence gained can be used to improve the intervention or its implementation or how it's adapted. So, for example, you might have an intervention that's got a positive trial result, or you've had some good outcomes from it, but you want to introduce it to a different place, or a different group of people, or you want to adapt it in some way. That's when you might start thinking in terms of a realist research question. So things like, what is it about the program that makes a difference, to whom, why or why not, when and how should it be used, or how could it be adapted? These are all quite realist research questions, but I do add a caveat, which is when not to use a realist research method. So if you want a quick answer, or you want a yes or no answer, or even an on average answer, then this is not the way to go. It's not about asking, did this work or did it work this time? It's really about knowing what works for whom. And the reason why it's not a quick and easy process is that it's an iterative method of theory development. So this is just an example. And again, I can't go into much detail, but it's showing that there are these 5 steps to what we'd call a full cycle realist evaluation. And you might not complete all 5 steps within one research project, but a full cycle realist evaluation would. So starting with developing this initial program theory. So that's your initial understanding of how the intervention works. And then testing that theory. So designing your research methods in an appropriate way. And I'm going to touch on that very briefly. Collecting data, usually quantitative and qualitative, or a mixture of qualitative data sources, describing these and analyzing these in ways that are guided by your program theory, and then merging your findings. So you'd have a sort of more detailed program theory that you could then refine. And that would be step 5, leading you back to step 1. So you've got your updated program theory or your refined program theory to contrast it from an initial program theory. And then from that, you can develop your recommendations. And a realist synthesis is sort of similar, but applying this to the published literature. So developing your initial program theory and searching the literature, extracting the data that you desire, synthesizing and refining the program theory. I'm just going to talk a little bit more about context mechanisms and outcomes. So we had this example earlier about the speed limit, and that an initial program theory, a very, very initial one, could just be phrased as an if then because. And you might have multiple if then because statements for the same intervention. When we talk about contexts, it's about the generative backdrop to the intervention. So you might think about it as what was there before you walked along with your intervention, before you introduced the speed limit. And there are the 4 I's of context. So again, this is complicated. There's a lot of layers to think about. Individuals, so things related to the participants' characteristics, their interpersonal factors, the relationships, the institutions that they're in, and their infrastructure. And the reason that generative is an important word here is that it's quite easy to sort of slip into thinking about a flat context, so rather than a deep one, and it just being a backdrop, a passive thing. But context is actually very active in a realist evaluation or realist synthesis explanation. So, for example, participant characteristics, you might think, okay, well, they are in a deprived area. And then they didn't come to the Healthy Cooking Club. They didn't arrive. And I'm going to try and connect those. But actually, what is it about the context, about that deprived area? It's not really their postcode. It might be that there isn't the infrastructure there for them to get a bus from where they live to the club, and their interpersonal relationships, for example, with the rest of the family and the person they're providing care to, means they don't have the time to get there any other way. And actually, it's not really about the individual, it's about the things that are surrounding them. It's not something within them that's causing them to not attend the intervention. And mechanisms are the underlying forces that generate an outcome. Within realist work, it's usually the things that are happening inside someone's head. So their reasoning, their preferences, their beliefs, and that drives their decisions and choices. So it's different to the program or the intervention itself. It's not the same as providing a list of the vegetables that you gave. It's thinking about this interaction of resources and reasoning. So the resources are applied, and that sort of shifts something within the minds of the people involved, the stakeholders. And these aren't really something that you can usually observe easily or directly, that you have to actually ask people about. And that's why there's almost always some element of qualitative inquiry, such as realist interviews or realist focus groups, some element of qualitative data collection, So because you want to be unpicking these mechanisms and understanding sort of why it is that people made the decisions and choices that they did. Outcomes are usually multiple. It's not about having one sort of primary outcome that you're only interested in, or that you might have some that you're interested in more than others. But it broadly includes what you intended to achieve, but also unintended things, sort of rare or unexpected outcomes, as well as those that are more frequent. Outcomes could also be intermediate and final, or proximal and distal, so one happening before the other. For example, you might measure sort of attendance of who gets to the intervention at the Healthy Cooking Club, who turns up, but you might also be interested in a different outcome later down the line. You wouldn't be expected to have the later outcome unless you got that intermediate one in place. And over time, the outcome can also become a new context. So that's this idea of emergence or feedback loops, that the way in which someone benefits from an intervention, or the way in which a particular area changes, that can become a new context that continues to explain the changes that are observed. So just as an example here, your intended outcome from a low speed limit around schools is reduced car-child collisions. Your unintended outcomes might be that actually the speed limit creates new traffic problems. So there's actually more traffic around the school now. And then an unanticipated outcome might be that the drivers choose to take a different route because of these increased traffic problems. And the route that they take actually has more collisions now. So the reduced collisions are just displaced to a different place. And that's an example of how the outcome can become a new context. So context mechanism outcome configurations are a thinking tool that links together context mechanism and outcome. And it's about the interaction that gives it explanatory value. So this is to avoid sort of a list of, here's a list of context, here's a list of mechanisms. You're interested in how they interact into leading to particular outcomes. Again, this is just a way of picturing mechanisms. It might not work for all of you, but if you think about applying resources to a particular context, that's shifting the reasoning and then leading to an outcome. Right, we are coming to the end. I have a few more slides, which I'm going to go through quite quickly. So as we said, realist evaluation is theory-led evaluation, and realist synthesis is a theory-led review, asking what works or doesn't work for whom and in what circumstances. Thinking about how to actually do this, and often in realist reviews, you would also have a level of stakeholder engagement. So this is relevant to both sides, whether you're planning your data collection or within a realist evaluation, or you're planning some kind of stakeholder engagement within a realist review, these are the sort of questions that you might be asking, and it's unlikely that any one person can give you the answer to all of these. So about the circumstances that led to the intervention and that indicate the intervention is needed, the recipient's responses, and different people will of course respond in different ways, and the intended and unintended changes that could occur. So I'd advise you to think about who's best placed to tell you what you need to know in relation to these questions, and how it is that you can reach them and meaningfully include them in your research. Just going to go through this slide quickly because of our times. But you can imagine from thinking about the number of different stakeholders that could be relevant even within a fairly simple healthy cooking club for carers. You've got the carers and the people that are being cared for and other family members and the people providing the cooking club. So there is a number of perspectives and things can get big quickly. And that's one of the big challenges of realist evaluation. I include this picture because that's how I felt trying to come to the end of my PhD and finish up my realist evaluation. I describe this as getting lost in the swamp. There's so many different people and different perspectives to try to consider. And the deeper you go, you sort of can feel like there's more and more to tidy up at the end. Having limited data where you feel that there is a missing perspective or a missing group of stakeholders that are really challenging to reach. So a big one for me is often the people that didn't attend an intervention, didn't want to come to the hospice day service, for example. Reaching them to talk to them about why is quite challenging, and then that gives you a limitation to your theory development. Some of the realist jargon can be a barrier, and it can be a barrier to engaging with people to plan realist research as well. So just trying to get comfortable with it yourself, but also develop ways that you can explain it clearly to other people. And relatedly, communicating CMOCs, communicating those configurations in a way that engages the audience can be challenging and sometimes requires some creative thinking. And knowing when to stop, when have you gone far enough? So the lessons here are to allow enough time, considering that this is an in-depth approach to research, and iterative theory development needs more time than you might expect initially. That you can break free of your traditional disciplinary boundaries. So stepping into sociological explanations or psychological or different schools of thought and ways of approaching a complex intervention, that can be really useful and stimulating and enjoyable, especially within a PhD setting where you're quite immersed in it. But there is also this need to be focused, to understand what your specific aim is, why you are doing this, and have that really visible throughout, so that you can assess your priorities and not get completely lost in that swamp. Taking regular notes, capturing your reflections and your reflexivity as you go through the process, sort of as early as you can, that will help you with that focus, and knowing when to stop, not expecting it to be finished or perfect. It won't be. Complexity doesn't work like that. It's sort of ever shifting sands, but knowing when to stop so that you can meet that aim. So just to finish on this quote from Ray Pawson, complexity confronts evaluation with a never-ending challenge that cannot be completed. The end result of a realist evaluation or realist synthesis, the end result will be partial knowledge about partial improvements that we can make in the delivery and targeting of social interventions, which is quite an achievement. So I hope this is enough of an introduction to set you off on this path, but do feel free to reach out to me if you would find that helpful. Thank you very much.